So the commonest cause of vulval itch in every age group, so what I mean by that is from childbirth all the way through to puberty, all the way through our teens, then into the stage for our reproductive years, our transition years, and on past menopause. The reality is that the commonest reason for itch across the board is likely to be a skin condition, not thrush. Thrush is certainly a problem, and it can be a horrendous problem for many, many women, but to assume that every itch in the genital area is thrush unfortunately results in a lot of misdiagnosis, a lot of inaccurate attempts to try and make yourself feel better or try and gain relief from itch with failure or perhaps worsening of the condition on your skin, burning your skin and making what is perhaps a simpler problem to resolve much greater, but totally understandable, because even though we are all encouraged and ideally would use a mirror to have a look, we still are labouring under the impression that first of all, it's hard to get at, and it's still St. Augustine saying that women are like the church, great wonderful chapels of idealism and purity built over a sewer. And that is still a pervading cultural thought that we must actually do our very best at every opportunity to dispel. So not everything that is itchy is due to Candida, and if you remember nothing else from today, I would be very pleased with that. So when we talk about a skin condition, the commonest skin condition will be eczema, and I may slip and sometimes say dermatitis instead of eczema, and I apologise. Once upon a time, these two terms meant something different. Nowadays, we use the terms to mean exactly the same thing. And it can vary from a slight irritation of the skin, which is a little bit pink and perhaps a little bit dry, all the way through to a great big weepy, crusted sore and prone to secondary or on top of the original inflammation, additional infection, which can cause it to spread, be more painful and more difficult and require to treat, which will require many different steps and obviously therefore longer to get better. And we classify eczema as dermatologists into different things, and the most common one is irritant. And I'll go into this a little bit more, but Geraldine's already discussed things such as squeaky clean scrubbing, perfume soaps, contact with panty liners. Those things, whilst they have their place and there are times when they're necessary and help us through our daily lives, they also can be a source of irritation, a source of allergy, but irritant dermatitis is far more common. I've put a little bit more information down there about atopy or atopic eczema because that's the one that most people think of. They think of eczema occurring in infants and childhood, and why would I have eczema as an adult woman? And the reality is that you might have been born atopic, you might have had a little bit of hay fever, or maybe not. Maybe you just know that you've got sensitive skin, and if you don't shower or if you use a certain deodorant, it's irritating. So you just have gradually learned to become accustomed to that in your life and you just don't use it. Or you use sensitive skin or non-perfume products in an effort to try and make your skin healthy without causing irritation. And within this, I would simply like to say, before I go any further, that unfortunately, even though being natural is something that we all espouse, that there are times when nature isn't good and isn't kind to us. Tea tree oil is an excellent antiseptic and a good product to use in certain situations. It's also related to the poison ivy plant and the rust tree and certain grevillea trees. So the more pure it is when you apply it to your skin wherever you apply it, the longer you apply it, the more likely you are to be the 1 in 5 people who develop an allergic contact dermatitis to it. And we are aware of a lot of global issues, and I will say to you also that uranium is natural, so is cyanide, and so is arsenic. So natural by itself, whilst it's a great marketing ploy, unfortunately does not guarantee that it is safe for use or appropriate for use all the time in every area. With respect to being atopic, the skin is abnormally sensitive. It's more easily dried, therefore it's easier for things that may not irritate your mother or sister or your girlfriends or your fellow workers or your classmates, depending on your age group, or even women in the book club, if you actually get around to discussing these things, then you are more likely to be irritated and go on to develop an irritant dermatitis. Genetics tell us that the barrier function of the skin is abnormal in individuals who are atopic, and that is whether or not you've got active eczema at any time in your life. So unfortunately, naturally, you've been born with sensitive skin. You may be fortunate enough to go through your entire life without it ever being an issue, but other members of your family may be affected. Or it might not be until you're postmenopausal and undergoing a little bit of urinary incontinence, and the constant wetting, instead of causing what we would consider a little bit of irritation, gives you a rampant irritation. And the more you try and wear pads and the more you try and put things on and just mop up the urine and don't actually protect the skin, which is unable to protect itself, the more you're going to have a problem. So what's so special about the vulva is that it's naturally warm. It's moist. Apart from when we're actually lying down and have a gynecological examination, there are folds and folds upon folds that are both protective and both the potential source for friction and irritation. Perspiration is normal within the groin. There are normal vaginal secretions that are there. They're there to harbour good bacteria. They're there to provide lubrication. They're there to provide an appropriate scent so that healthy bacteria thrive. We like the scent if we get accustomed to it, and the time that this is particularly important to remember is when those of us here might be speaking to our young sisters or daughters or granddaughters, should they come and ask us, because puberty is a time when a lot of change happens, and a lot of these changes reverse then as we transition into being postmenopausal. So it's a life cycle, a little bit like the riddle of the Sphinx, where we start off on all fours, end up on two legs, and then we can end up on three at the end. So the other thing that contributes to vulval irritation is the fact that as a part of everyday living, we wash the area, we wipe the area, we might use flushable wipes. Fortunately, the flushable wipes that hit the market about 2 years ago containing a very potent allergen have now been withdrawn, but there was a horrendous spike in women who had itchy vulvas at that point in time until the actual culprit was identified and they were able to be removed from the market. We don't have to, as Geraldine said, smell like Chanel No. 5. What a boring world. Having a homogeneous set of vulvas in the world is not going to do anybody a favour, and apart from the porn industry, and be it paper or on other forms of media, where it obviously is quite successful. Okay, simple act of having sex, introducing semen, that will change things temporarily. And sometimes that can be enough in an individual who's a bit sensitive, or maybe has gone to the gym or gone for a bike ride, in order for everything to be just that more sensitive, and that flips them over into feeling a bit itchy temporarily the next day. That isn't necessarily abnormal. It certainly isn't consistent and isn't Candida. But so you need to be aware that you are not the same person every single day of your life. Your vulva isn't exactly the same every day of your life, nor is it the same when you're having periods. Throughout your menstrual cycle, there are many things that will vary. Naturally, there are variations in your hormone, and also if you happen to be using oral contraceptive products, whether that's spermicides and condoms, or whether that's the oral contraceptive pill, that will also alter your hormones and alter what is normal. So it's essentially a naturally lubricating, self-cleaning area where healthy bacteria flourish, to protect us from a wide variety of things, including keeping Candida in check if it comes there. Sometimes if it does come and we are not normal in our protection, or we've had our natural barrier interfered with by things such as antibiotics, Candida can take hold. The important thing is that it isn't a dirty area and it's not meant to be squeaky clean. So the 1950s and 60s advertisements to lather up and be squeaky clean are, in fact, if you follow them, a good reason to have itch. This is just a brief list that highlights the fact that, irritant dermatitis, as I've been talking about, is the most common after puberty and before the menopause, so during your reproductive years. Lichen simplex is a form of eczema where we really don't find anything abnormal, but it's constantly scratchy and itchy and one can flow on from the other, and sensitive skin can lead to that. And what we then see in some women is that the skin gets rough and thick in an effort to protect itself from what's irritating. The other, Candida, you'll notice there that after menopause, Candida is nowhere near as common. And the reason for that is that Candida needs estrogen to be present in the vagina so it can be thick and healthy and supple. And if that is not present for the Candida to basically have a feast on, it can't thrive. So before puberty and after the menopause, Candida isn't as common, and if it's there, we should be thinking, okay, is this lady on hormone replacement therapy? Is she diabetic? Is this young girl developing diabetes? Are you generally healthy? Are you low in iron? All of those factors that will make you generally unwell should be considered more highly when you're outside the reproductive years and if you happen to genuinely have Candida. Atrophic vulvovaginitis now being replaced by the genitourinary syndrome of the menopause, because more happens than just getting dry. But as the vulva gets drier, and likewise the vagina gets drier, and the tissue gets more friable or more fragile as you enter postmenopausal years, that too can be itchy and also more sensitive to irritants. Now, lichen sclerosus is a specific skin of the disease that is probably the commonest other condition that we see in this age group, and it can be intensely itchy. 97% of women will have horrible itch. And I could not put a figure on the number of women who have undergone therapy with an assortment of anti-thrush therapies for a long period of time, who then come to me and they have obvious lichen sclerosus. So if you have itch, please have it seen to. Make sure you institute some good hygiene, which I'll just touch on a little bit later. Don't assume that because you're itchy, you've got Candida. Do yourself a favour. So psoriasis and allergic contact dermatitis and a whole range of other skin diseases can affect the vulva. Essentially, it is skin. These are some of the things that we do to our vulvas as part of our normal daily lives, although I don't think that really fits to the top right-hand corner, or at least I would hope not. If it does, I congratulate you on having a superlative body, and on being so enthusiastic to keep it that way, but I wouldn't want to be you in the morning. I find it very hard to imagine anybody could do that and then wake up with a nice, comfortable, non-swollen, non-irritated and potentially itchy vulva in the morning. Pubic hair is public enemy number one currently, as has been alluded to, and some people cut it, some people comb it, some people plait it. You will find cartoons where some people are supposedly knitting it, and some people shave it, some people put on exfoliating cream. We also have laser therapy. I'm not saying that it's inappropriate to do this, I'm just saying that naturally there is hair there, And when you remove hair, there is the potential to irritate, to cause small abrasions, which may introduce infection, may cause itch, may cause soreness, and particularly with repetitive use, that can build up and produce a problem. Similarly, when we use something like panty liners, those wings, particularly if you're not a skinny model for whom they were obviously designed to fit under, well, partially under some of the underwear that's currently available, the wings can be quite irritating, the adhesive can be irritating. You certainly don't want to have pubic hair if you accidentally put it on the wrong way at night, because you will be sore as well as itchy, as well as having to deal with your menstrual blood. So they are a potential source of irritation, a potential source of perfume, and a potential source that the glue can also cause an allergy. So in that setting, again, it's something that we all consider, and it is a perfect normal component of being a woman and going through menstruation and reproductive years, yet it can also be a problem. After the menopause, what happens that changes things? And again, we've alluded a little bit to this, but the natural changes of ageing not only cause things to sag, they cause them to become drier, which means that they can become easily irritated. The vulva can become paler, and that can be perfectly normal. The amount of fat that's down there changes. Again, that's perfectly normal, but you might find changes in sensation relating to intercourse, your capacity to sit for periods of time. Being an octogenarian and being able to ride a bicycle is quite a feat for a multitude of reasons, the vulva not excluded in that. Continence may become an issue because conscious control of urine flow is partially estrogen dependent. Likewise, our anal sphincters may not work quite as hard, so we might, as some ladies, we might either fluff, or you might actually pass wind, or you might actually fart more than usual. And my darling mother, who is now 88, once gave me a Christmas present, because the rule in our house is that it has to be humorous or particularly pertaining to the individual to whom the gift is given and cost no more than $20. And she got me this 3-inch or nearly 9 centimetre in size giant fly keyring, to which was attached a splodge-shaped series of hard paper sheets that had on them 100 gross and disgusting facts, of which that in every fart there are 100 million bacteria that you release into the environment. The pH again changes, meaning that irritation can occur from things that may not have previously been irritated, and possibly a good thing, pubic hair reduces in amount and in the vigorous nature with which it grows. So I'm going to end there so that we can all go and have a break, and I'll be available for answer questions later. Thank you.